Monday is the deadline to sign up for health insurance under the Affordable Care Act for coverage that would start January 1st. Our state's version of the system is known as Covered California. Earlier, I spoke with Lisa Aliferis, editor of KQED's State of Health blog, to get a status check. So, Lisa, thanks for joining us.
Good to be here.
California's version of this health care mandate is called Covered California, and this week they released updated figures on how many people have enrolled. What are the numbers?
So earlier this week, the first 3 days of this week, more than 50,000 people have signed up. And that's a dramatic, it just keeps increasing. On average, the first week of December, 7,000 people a day were signing up. Last week was climbing to 15,000, and it's escalating from there.
So that's a dramatic increase then.
Yeah, so we've got more than 150,000 people signed up now.
Okay, so it seems like Covered California is going fairly smoothly, not quite as smooth for the national program. In fact, just late Thursday, the Obama administration unveiled yet another policy shift regarding people who have had their policies canceled. What can they do now?
So the administration ruled that people with canceled policies were no longer required to fulfill the individual mandate, and that they are eligible to purchase catastrophic plans. Now, previously those plans had only been available to people in their 20s. These catastrophic plans have a higher deductible, $6,300. They cover 3 doctor visits only and certain preventive services. But people have to be careful because that may be close in price to a bronze plan. And in addition, we aren't sure yet if the new regulation from Washington applies in California. Covered California executives have been meeting all day Friday, and they are trying to determine if they must comply with this new regulation.
But again, this is another example of how confusing this has been, the constant changes. I would imagine it erodes public confidence and is rather confusing for insurers.
It's the California Association of Health Plans released a statement today saying that this could potentially damage, could undermine the coverage, and the state's insurance commissioner, Dave Jones, who was critical of Covered California because they refused to let people renew their canceled policies for the next year. He too he's criticizing Covered California and telling them to let people to comply with this regulation.
So just real quickly, if you still want to enroll this weekend, there's time. Monday is the deadline. What do you need to do?
Okay, so if you think you qualify for a subsidy, which you can find out on coveredca.com, you need for everyone in your household, date of birth, social security number, zip code. If you're an immigrant, you need numbers from your visa, and you should be sure and allow time, because it takes some time to enter all this information and to get through the process. If you do not qualify for a subsidy, though, you do not have to shop on coveredca.com. You can go to ehealthinsurance.com or to other private exchanges or direct to a plan, and you can enroll that way.
All right. Well, Lisa Aliferis, thanks as always for that explainer.
Good to be here. Thank you.